Right, everyone. So thank you so much for joining the session. This is Dr. Sharia. We are going to start this session right now. In the beginning, please mention in the comment section from which city or country you are attending this session. We're just going to start in a minute. Actually, a very important, topic that is coming up. Actually, especially like as you all can see, mentioned already. Like what are some of the important updates regarding the AMC. But in the beginning, please mention in the comment section from which city or country you are attending this particular session. Actually, I can see in the comment section there are people from India, Bangladesh, Pakistan. They are joining. It's wonderful to know. And there's Sri Lanka, there's Nepal, there's of course many places in Australia: Sydney, Melbourne, Perth, Adelaide. Yeah, so that's really nice, actually, guys. Please, very, very important update. You all should have a study partner. I highly, highly recommend. Do not study without a study partner. You probably did well in MBBS, like solo study, because the amount and the intensity were low because you are finishing one subject at a time. But here, so many subjects at a time, and you need to know update all the time. So having a study partner is really well. I can also see people from Malaysia is joining. Actually, great. Good to have all of you. So my name is Dr. Shariat, and we are going to have a session today with some of the updates related to AMC, about 2026 updates. Actually, I'm a little late on making this video. I was like into some researches. Yes, so before we start, like there's sometimes some people ask, doctor, I have this, that, the problem, like, so many problem come to us directly. But did you know this information that AMC has their own official, inquiry email, like MCQ? This is the official inquiry for AMC part one. Or if you have any specific question, you can also take help. Like say, oh, one of the question I found, okay, doctor, for EPIC or InterHealth I have done for USMLE, but do I need to do it again for the Australian Medical Council? So those kind of things, you can email them actually, even after passing, if there is certain confusion and this, that, you can also do that actually in that case, actually, if there is a confusion uh, after MC part one, actually, how to proceed, why to proceed, and what are the things. They do have email. Their response time takes time, but you are expected in 2 days to get an answer, actually. All right. So here the things also, time to time try to check the official website of AMC for the updates. This is the official website for AMC to check all the updates. I know specifically about us, like, if you want to get in touch very quickly, this is my WhatsApp number, so you can get in touch for prompt response. We do have that email. You can email us, and also this is our website, actually. All right. So usually, like, our response at 24 hours, but usually the response comes in like 1 to 2 hour, actually. Yeah. So that's some of the updates. Now we are going for today's why we are here, that particular session about AMC Part 1 Exam 2000, and lots of update presented by, of course, this is me, Dr. Sharia from Shares Medical Academy. I've been an MC tutor for 9 years. Under my guidance, I can proudly say there's over 1,900 doctor passed, and in my record, there's more than 1,300 working in Australia. It means every hospital in Australia, I know someone who is working. So you should come join and study with us at the same time. We have a big network, actually, not only constructive classes, but networks. Get to know each other, get to know the seniors, alumni from our academies, and so that'll be really, really nice. In coming days, I'll be also conducting session. I will go to Australia again and will conduct some communication sessions. And at the same time, actually, like, I will invite some of my ex-students who has already been into the hospitals and this, that. So they'll be get together, I think, in this year somewhere at this point. Great. So here we go. I mean, with some updates, let's see what we have here. Let's see what we have here. Great. Now, very important thing that, why we are discussing this today, actually, because it started with the email. Those of you who have done the InterHealth and MC account making, through the account, you all probably received an email mentioning that MC 2026 exam. is somewhere going to change or updates and this that. Now, my question is, how many of you have got that particular email? Let us know in the comment section. Even if you've seen this thing in the YouTube, you can also mention us in the comment section. Actually, I think most of you, I mean, even if you have opened your account, portal account, I'm sure all of you have received that particular email actually. Okay, everyone is confirming in the comment section. Yeah, so they do have this one that they don't know what to do. Some of them assume one thing is was clear, their intention that exam is going to be more harder. But what to do, where to focus, that I will tell you as an expert actually. Yes, I know few people also from the Australian Medical Council, of course, and at the same time, big network and this that. So I mean, I was waiting. I mean, to tell more about these things, like what's gonna happen. Certainly, after exam starts, we can tell more, but these are some of the assumption and some of the few things, which I'm going to tell you. Probably, at least for the April May candidates, which they don't know what to do actually at this point, would be really really helpful. I will make it another session after April May exam where the official changes they will make actually. Great. Now, coming to the thing, significant updates to 2026. Is it really significant or not? That's the main question to all of you. Significant in a sense, they're raising the bar. Raising the bar means the question difficulty and questions aspect and the system. They have question. They still have question they made probably on 2000 maybe 17. They still test those questions actually. Okay, so they probably do one thing that they are remodeling everything actually. So new set of question, new updated questions, new screening questions, you all need to focus. That brings us to the point. Few of the things need to emphasize more, that is the community health boosted, population health, indigenous community, and also pharmacology and updated drugs actually, and updated microorganism. Okay, so these are few things. In the main lectures time to time I'll tell even more things actually. Yes, so more things enhancing clinical resourcing, so more evidence-based thing. Guys, have you ever heard about evidence-based medicine? Have you ever heard about the word evidence, yeah, based medicine? I'll start in that way. How many of you ever attended my respiratory system class? Obviously, some of the doctors from our 5 months course previously, then maybe they joined the recall course. Has anyone here attended my respiratory lecture? Please mention as a respiratory. Okay, yes. Now, if you remember in the respiratory system lecture, I gave a evidence about inhaler, using a inhaler with a spacer device with an inhaler, and using nebulizer. Both of them has similar efficacy. Inhaler with a spacer device with a mask on has a similar efficacy compared to a nebulizer. Is it a level A evidence? Is it a level A evidence actually? All right, it's a level A evidence actually. So this is like evidence-based thing. Also, for a acute asthma patient using IV hydrocortisone, or even if you use the tablet prednisolone in appropriate dose, has also the similar efficacy. That is a evidence-based thing. So these are called the evidence-based. Maybe I'm just giving you an example in the lectures. Next time when I will make like some of the lectures in coming days, I'll try to give more emphasis on the evidence-based things actually, more actually for you guys actually, because as per the AMC, you also have to change yourself. So the more lectures will come up in coming days. For example, we see a question, we discuss a question, then I discuss about the differentials, and then we move to the next one. So from now on, probably I will try add some slides, okay, about this topic. What is evidence based? So if this is a highlighting word, is the evidence based. So if there is any book evidence based and this that, try to focus on them. John Murtagh itself is an evidence based things, evidence book, but there are more punching lines out there actually, and of course they will target the punching things. Patient safety protocol will be more. That brings us to the point that they are gonna ask you more questions about the ethics and also the patient safety at the same time. You're going to introduce a drug, and what is the safety measures is very, very important. You try to use clonidine, and you need to double check, of course, the CBC while following up. Of course, this kind of things are very, very important for you. Now, coming to the indigenous health, that's was there for a long time, but I think separately you should follow the indigenous guideline. I hope so. In this particular the batch, we are having this recall course. I think we are probably are going to have a separate session only on the indigenous health. Okay, so this is a good news actually. All right, so this will be something related to indigenous health actually. Great. Since 2026, everything gonna start even from the February, but the more things. That's how they say that it's February. February every year it's a new like the system, but the email and everything they have mentioned that from the April that's officially gonna thing. So slow start from the February, final approaching in the April. Okay, I hope that's clear. So the email that came, it says like, so every year there is like a December, January, there is no exam. So the full set of new questions and this, that. So they will have a warm start in the February, but from the April, that's official actually. I hope that helps with the information. You all must be knowing about a few of these things. Like you should know one thing, and many of you inbox me about this in doctor. Is this things gonna change actually? Duration is going to change? No. Total number of question answering? No. Passing mark 250, it's again not gonna change. Now that brings us to the point: is MC exam format is going to change? Example: if I take you back, I have another session previously in YouTube, like MC new changes, which I uploaded 3 years back. That one actually there was some format change. And why I'm telling there was format change, because earlier days when we were giving MC exam, there was an option for flagging questions. What do we mean by flagging? We flag it. At the same time, what we do, you know by the flagging thing, is a some sort of going back and seeing that particular question, going back and seeing that particular question, right? So we used to see the question, we could review. Now the whole option is gone. So you probably need to finish. Now previously we used to finish the exam like 30 minutes earlier because we were skipping some question. Just click one, flag it, and go to the next one. That whole thing is gone since last 3 years actually. Now you cannot review for last 3 years. So that was a format change. Now this time, is there any format change? Not really actually. They are just improvising some new questions, setting a new benchmark. They were using a lot of, still I saw PAP related question. Even last year I saw a PAP question, like how come PAP question came up? Even though PAP smear they're not supposed to use in Australia now, right? HPVD, and it's the update. So they are going to change the whole, I think, the question bank thing, or the majority of the thing which is not newly updated actually. So there's a major update that is coming, but not with the format. Okay, is this clear? Please mention in the comment section. Is this thing is clear so far actually? Okay. I'm not following the questions now because we are taking a session. I'll take some questions at the end. Okay. New concept emphasis areas for 2026. Okay. Again, as I said, I'll make a uh, special video on what are actually new topics started to come after reviewing some questions in coming days. But officially, unofficially, some information what I got: the indigenous community, the population health. I mean, there'll be more questions. So that means the indigenous community, screening programs, community health, so these are the areas, because this part would be helpful actually. Yes. They always try to, have the approach like, the too much dependency on the recall for the candidates. Uh, I always keep telling that one, like, should not be, recall should be a part of the thing, actually, not like a main thing. Theory is always the lifesaver. I'm not sure how many of you agreed, but those past, they all say like theory was always been the lifesaver. Some of them got lucky with the so many recall got repeated. Depends on the exam days, exam months, and also personal preparation. But not everyone always get lucky, because you think in that way. You have to crack the exam and go out using your own theory, your own concept. and your everything. Do not, you know, over depend. Do not over depend on the recall only. Actually, nowadays, we also take exam week support group. But thing is, actually, nowadays some people started assuming that exam week recall is everything. They want to kill that part actually. Okay. I personally might, give a recommendation to MC someday to stop probably, or, have one day, uh, MC exam like in a same format. I think it's more easy like plan actually, instead of actually having 7 days, 7 days things actually. Anyway, so indigenous community, cultural and safety. Example, like I would like to add in that way. Normally, a kid's mother came with a sick kid. The person would be, of course, interacting with the doctor. That's what we expected. But someone from the indigenous community comes compared to a normal, they will not do much interaction, and you just see the kid and the patient go away very quickly. Now, would you suspect something about the uh, child abuse because the movement is suspicious, or is it a cultural difference? Assuming if they are like more shy and this, that actually. Guys, I mean, we can comment the question answer session little later because I'm missing your questions now. If you put things there, we'll get back to you actually. Now, thing is here, it's a cultural difference. Aborigine mother or indigenous mother came with a sick kid and not interacting with doctor much, not doing eye contact much, because they're shy, they're cultural differences. They don't know you well. They're not comfortable with you that much actually. They don't know much about communication. So it's a cultural difference. So this is a type of question gonna come more. This is a previous topic. So previously we have been following. So those topic will be tested. I know like usually what topic they're gonna emphasize in any way. So more previously, I've been a tutor for long, so I know what are the parts they're going to emphasize more. So indigenous community, there are more things, but definitely certain questions out there actually. First, you need to finish the John Murtagh, then we'll also guide you a few things about the population health and indigenous community. Those you need to do. So it brings us to the point. Also, we have our own SMA note on individual topic. So probably we will add another new topic on the indigenous community and also public health and also pharmacology. That's great news for all of you, actually. All right. Now, emerging new diseases like last there was COVID, there was new things, Nipah viruses, Australian encephalitis, and any other things, which is like you think like antibiotic resistance being, something very, very important. So climate changes, by the way, questions can be asked. Yeah. So and various investigation protocol, a new investigation, by the way, guys, I am telling it again, perhaps the new investigation things would be asked. Very, very important. New investigation. All right, that's great. And also preventive medicines, actually. Preventive medicines would be more important in coming days. Already we mentioned about that one, and updated pharmacology, like not only about the drug and drug indexes, and also maybe a little bit more you need to know about the drug side effects, what things to consider before giving a drug. Is there any major drug interaction? Yeah, I'll tell you some references in coming days and some reference books, and of course some guidelines I will add in our SMA note that can also help you actually. Okay, great. Also, category A, B, C, D drug, especially in pregnancies, would be also very important. Clinical disciplines, you must be knowing about this medicine, surgeries, pediatrics, that's you all do, then obstetric gynae, then the psychiatry, then the ethical things. Nothing much changes, but again, that, community health section, psychiatric section, they love to ask more questions. In last 2 years, we have been seeing, and there was updated information at the website. They look forward to more preventive medicine, psychiatry, and ethical questions, and it turned out to be true. And there was actually more psychiatry, ethical questions we could see after that. So since now they're telling uh, these areas, so of course some new diseases, indigenous things, and the updated pharmacology. So it means you have to be a little bit more careful. So recall will be important, but to a certain segment, but more new researches, more new updated. guidelines, and just looking into RSCGP will not be enough actually. So perhaps you need to look into some other websites. So not only John Mukta's and the other things too. So as like when you're in a academic environment, what professor also wants from you to keep getting updated with new guidelines. It's kind of like that in MC. People like to eat like as things like a spoon feeding, but they want you to get out of your comfort zone, answer the questions with your right ideas and enthusiasm. They'll try to confuse you even more in the exam hall. I'm telling you, they'll try to confuse you in the exam hall even more with the same common topics. All right. Test center, this that we already know. I mean, is there any major changes in the test center? So, a update came up after the uh, AMC. You must be knowing there was, uh, I mean, the Part one exam has so many centers, and they keep increasing the centers. The last two addition in the centers were in Sri Lanka and Pakistan. The Pakistan one, the updates are uneven on and off actually. Like sometimes we get news that it's open, sometimes it's closed, like scheduled for November 2026. It's under observation, something they mention actually. If anyone from Pakistan, did you get a date for Pakistan Center? Please let us know in the comment section. If you are listening to this particular session, do let us know in the comment section actually. So we don't get much update on that one actually. So anyway, so Pakistan and Sri Lanka was the last two addition. No update about Bangladesh yet this year actually, but maybe hopefully yes. Yes. Yeah. Okay, some people mention they are getting dates, but no official emails so far, actually. Okay, that's good. So Australia has center and non-Australian centers. So always look, whenever you pay the fees, you can see the centers actually. Great. One more thing, about uh, a new update in 2025, a very new update, I would say. This one, this particular section is actually a very new update, honestly speaking. And that new update is what? In terms of verification, guys, and that is nothing but your my Intel. Now, how many of you opened your account already in using the Intel? How many of you has opened your account with? So this is a new update of, I can say, 2025 and 26. Okay, so here we go. So this is, you can say, 2026 because it started at the end of the 2025, so it's a 2026. One more major update that basically through an app you're trying to do your verification. What is verification? It is actually a proof that you are a international medical graduate, that is the IMG. Otherwise, where there is a proof, there are also quack doctors, right? So where is the proof? So your medical college needs to go to a certain verification through this process actually, and also using the notary cameras and all this thing. Yeah. So the process can take some time. You all need to be patient. The verification things takes time. I'm telling again that you need to, it can also vary from medical to medical, country to country, person to person. Okay. So just need to have little patience actually. Exam booking system is kind of like the similar, it's nothing much actually. It's just the date comes like that. They show the dates like 11, 12, 13, 14, 15, whichever available, like, will be shown and you can book a date. It's kind of like that. All right. Then there is a thing called document submission, upload and verification of your document, and you can track, you know, anyways. Actually, we're not going there actually. Great. Official AMC preparation resources. I think we all knew about the books and this, that, already knowing it on John Murtagh, then, MC handbook, the preventive books, therapeutic, Linian Jones, Kaplan series, even Davidson's. Yeah. I do have a book, MC bestseller, actually. That also includes some of the previous recalls, actually. If someone wants, you can collect from our Dhaka office. Actually, only it's available in the Dhaka office. That's okay. Okay, but some of them can be really game changer actually. All right. Now, of course, we do a lot of practice, so don't worry. I mean, we also do a lot of updated recalls in the main book. But if anyone wants to interested checking some of the previous ones, then it's given quite a system once actually. That's like officially we posted on 2016 probably, and then 2018, 19 we updated loans. After that, we didn't update much actually. So you can say it's like a early days recall things mostly. Yeah, but it's organized. Yeah, that's the thing. Official MCQ practice design, we also provide it, so that's fine. But AMC website, they will also provide one practice mock. Previously, it was there too, and now you'll also get that chance. So anyone is going for April or May, you want to see how it looks like your screen. So through the official website, you can also give a mock test actually. Okay, that's the thing. Updated question bank. There's so many question bank in the market. I directly don't comment on that one. So I think there are Amidex, there are now eMedici, came up. Actually, don't ask me to compare. As a director of a program, we cannot really comment on anyone could get affected actually. Whichever you do, do one properly and keep revising it properly. Take note from the question banks too. There's nothing like a tonic that you just finish it once properly, and you definitely pass as nothing will happen like that. You still need to go through John Murtak and theory, SMA notes, recalls, everything. So all are your part of pillars actually. All of your part of pillars. One more updated thing about passport thing inquiry comes to us so much time. If you don't have a updated passport, actually it's better to update your passport and then do the verification. If you have already done the verification and you need to change your passport, then you change your passport and update it to AMC later actually. It's a vice versa anyways actually. But if you have time, better you update your passport. If you see you have only 6 months or 1 year, better to change your passport in that case. All right. So, MCQ practice, this, that. I think about indigenous health, there'll be more learning modules will be provided also from the AMC a bit. But don't worry, we'll be also guiding you about the indigenous health. We know about, how it works in Australia actually. Some third-party websites can be useful. I mean, other than this, books like therapeutic guideline can be very well. So TG complete Australian, yeah, medicine handbook. This like comprehensive book for pharmacology. I have it in my collection as well, actually, at the time of my practice, and RSCGP like resources. So RSCGP we know, then therapeutic guideline ETG, this one probably some of you might not know, and Australian medicine handbook. That's not the handbook, not this handbook. This is a separate one. It's like a drug index because they'll be emphasizing more about the pharmacology. So Australian medicine handbook perhaps can be a little bit more um, useful in coming days, like giving a little bit more emphasis on the pharmacology actually. We yet don't know how advanced the question can be for the pharma, but it's a possibility in coming days we probably have to go through a more advanced pharma or clinical pharma. Certainly, they're not going to ask you pathophysiology and this, that, but a drug, a classification of the like drugs and their side effect, drug interaction, these things, and any new drug and compared to old drug, like what will be the major changes, those things they're gonna ask definitely. Example, if there is an anticoagulation like warfarin, is there any other new update on that one in the anticoagulant family? And if it is a yes, how different is that from the warfarin? That's how the question can be. Great. So officially computer adaptive. Did you know that Australian Medical Council exam is a MCAT, it's called. So it's a computer adaptive system. So based on your answer, they can give you question adaptively. Did you know this information? So computer adaptive system. Yeah. Let me put my charger. Okay. It's an adaptive system actually, by the way. Right. All right. MC might launch an app. What we heard actually could be helpful, maybe for users for a free use. Indigenous community module. Okay, they have mentioned. Now, uh, It's also better to tell about us. Like we have a very good passing rate, and this amount of IMGs. I mean, if we include the November result, I think this is the number that is still we are counting. I think it's near to 2000 already started, and I think yeah. So comprehensive good, like computer adaptive, like MCQ, also designed for this particular recall course and the new courses we take. Yes, and those of you in the MC, you have attended the theory lectures and this that we follow the latest guideline. We are the first people who started John Murtagh ninth edition class taking, marking on options during the class. Yeah, first ever, definitely the ninth edition actually. Whereas some people just give a page number reference, we directly show you the books actually. Great. Okay, now a few more things about before we finish up. Uh, Evidence-based strategies, again, evidence-based strategies to follow. I'll tell you more about it in coming days in our sessions. What I give you a few clue about evidence-based, but in the main slides, I will try to make some more changes with evidence-based things. Yeah, we have been experienced with this thing. I mean, I was a program director of Train the Trainers as well, actually, in past, actually, in overseas countries, actually. Like I used to train all the teachers as well, actually. So different type of programs being launched, different time for variations. So I exactly know evidence-based medicine thing, what they're trying to mean. So no worries, we will all together get through it. So don't worry. Actually, keep in touch with us, even if you're not from our academy. Keep in touch with us. Happy to help anyone, actually. Okay. So master clinical reasoning over memorization. Now, this is a thing, you must be knowing that some doctors just like to memorize, just like, some people, it's okay for few things, but not. So the memorizing thing should be less, and the questions should be kind of like that. Like you have to answer by thinking, so practice integration formation multiple resources to reach clinical conclusion. Okay, that means a confusing question they will give. The similar type of question they will try to confuse you even more. Time management is so important. Now, did you know like every year, at least I would say like 5 to 10% people fail just because of time management, in my opinion, actually, generally speaking, like, so let's say 10%, like, I'm not talking about my academy. Generally, I'm telling like probably 10% only fail because, oh my God, it's late. Yes. Oh my God, it's late. So very, very like, so I think time lapse practice, you will see our mocks and there will be some guidelines will come to you guys actually, but separate your time into 1 hour, 2 hour, and 3 hours so that you in the late you have some time. So I recommend you to divide like in 1 hour, like at least like a 50 question, 50 question, 50 questions, so that you at the end. So even if you take 5 minutes more than 1 hour, you can at least finish it in time because the exam is a 3.5 hour. Okay. So in 1 hour, try to at least finish 50 or near to 50 actually. Okay, and keep it in mind if you're late, then fast, go fast. Later, the some of the cream question comes at the end. This is another important thing. That's the insider. Still date, I mean, in my 9, 10 years of observation, the middle part of the exam is always been like more bigger questions are given actually. So that takes a lot of your energy. Yeah, maybe you can go quickly out and take a pastry. Actually, you can do that. There is option for you know going out from the exam hall. I mean, you are given a locker actually. It's okay. No worries. So time mode practice would be very, very important actually, approximately. Yes. So approximately 90 seconds per questions, but I would say it should be like a 75 second actually, because if you put 90 second, then you'll take a little bit more and your exam will be over by the time. So here is the thing, like this particular word. 90 second. Okay. So deeply engage with interview, again the same thing yourself, like stay with the current MC announcement. So check their website, check your email. So email you will get to see more faster and advanced actually. Website updates came later actually in MC actually. Yes. Here's a very important thing, like clinical note passing standard. I took this line from the MC website. Like there's a slight increase in the passing standard, making it marginally more challenging to pass than the previous year. It's official now, but without changing any format. Is it clear so far, everyone? without changing any format. So basically, new topics, confusing topics, okay, more evidence-based, more practice, and maybe the level they're increasing a little bit more. You don't need to scare, just keep studying a little bit more. If you're not sure, you can change the exam a little bit. So do more theories, do more recalls, focus more on the SMA notes and the coming days, actually updated guidelines and this that. Uh, do not try to study everything without knowing it, like what you are really doing. Some people are okay, RSCGP, everything, let's finish on that topic. You are like going to lose at some point actually. So strategy, go little bit strategically, take help from the mentors, take help from the friends, take help from different forums, what you are studying, my dear, actually. So this all things would be important for all of us actually. Okay, so scoring thing remain changed actually. All right. So, anyways, guys, feel free to join us actually, and we have a very good 5-star rating. You can check out pages about the reviews. Great resources actually. We give you support during course and even after passing. I mean, and we have some great YouTube channel. You can take help actually. Yeah, and we also make like post like who is trying to make a study partner. This that I always keep telling that one, having a study partner is a blessing. So some of the course content which features interactive free courses, class records, organized things, career guidelines, and this that would be coming with the courses. This was the slide we started with, but we kept it at the end again. So this is our official website, and you can check our official website, MC Online Coaching, and it's WhatsApp. But I think if you just came in my Facebook, land on my Facebook Messenger, that's also okay for us. Okay. If you have inquiry actually to AMC, like a say Epic and changes and this that, so you can also email AMC rather than only texting us. Actually, side by side, a collateral would be better. If you already pass AMC, and then you can email AMC Clinical, like when is the next date and this that. Can you help me? I have this problem. Even if you can't fly, I mean, we always get question, like about scheduling exam date and this that. Of course, like the right month and right dates, you can message us, but definitely, uh, this is very, very important that in MCQ, or you can email them for updates and this that. You can always start your journey with us. Thank you so much, guys. I mean, that's the end of the pre-list session. Actually, this is like a more something towards we wanted to do about that AMC new changes. I hope you thoroughly enjoyed that, and I hope it would be useful for all of you to get through it actually. Yes. All right. Yeah. Mm. Great, guys. So no worries. We do have a recall classes coming out. That'll be really, really nice actually. Great, guys. In recall courses, you get like our 5 years course contents, including the recording and this, that actually. No worries. If you have course related inquiries, it's better not to ask here because I might miss the message. You can leave a question in our messenger inbox actually. Great. Okay, so our my dear doctors are ready. Yes, for the session. We're going to start the recall session now, and that's the end of our updated session about AMC actually. Yes, that's the 2026 updates. Our recall session will start soon. Thank you.